Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Important stains in pathology. So what does it include? So the first one is the alizarin red S stain. Alizarin red S stain. So this is the used for the detection of calcium. Alizarin S stain is for the calcium in the tissues. So you can tell it's for calcium. It's very important. Then comes the chloroacetate esterase. The chloroacetate esterase. Chloroacetate esterase or the letter stain. This is to mark the neutrophil. So it is for the neutrophil. Then comes the Hale stain. Hale stain is for the bile pigments. Hale's stain is for the bile pigments, that's the bilirubin. Then moving on to the Mason-Fontana. The Mason-Fontana stain is for the melanin and some neuroendocrine cells. So Mason-Fontana is for the melanin as well as the neuroendocrine cells. Then we move on to the Pearl's Prussian blue stain. So before that, this Pearl's Prussian blue stain, this is this one, it is the iron in bone marrow macrophages. Iron in the bone marrow macrophages. Now, what about the rhodamine? The rhodamine is for the copper. Copper, what is it? It is rhodamine stain. To learn and grow daily like this, please do subscribe.